You sit on them. You need them to walk. Your legs connect to them, and they provide an attachment for dozens of muscles and ligaments. They are your hips. They are a masterpiece of engineering. But like any precision instrument, if they're not fitting just right, all kinds of problems could arise. Do your joints click when you walk? Do your feet flare out or in? Does one appear shorter than the other? Do you have a leg, knee, back, hip, or low back weakness or any kind of pain? If you answered yes, then it's time to get a chiropractic checkup. Your hips are a masterpiece of engineering that chiropractic can help keep balanced and in alignment. I'm Dr. Kim Carlucci from Montclair, New Jersey, and as a practicing chiropractor, my primary job is to correct subluxations. Subluxations are a distortion, jamming, or locking of your body structure that irritates, pulls, or compresses or pinches your nerves. It unbalances your posture, weakens your discs, stretches your ligaments and tendons and muscles, and can upset your general health. As terrible as all this sounds, many times subluxations are often initially painless. You may have one right now and not even know it. When you were born, you had many more bones. In fact, each of your hip bones was originally 3 separate bones: the ilium, the ischium, and the pubis, and they usually form around fuse around puberty. Behind your hip bones are your sacrum and your coccyx. In the front, they form the pubic bone. Together, all these bones make up your pelvis. A joint is where 2 bones meet, and your hips have a few of them. One is the ball and the socket joint, where the head or the ball of the thigh meets the bone, that's the acetabulum or the socket of the hip. Another is the sacroiliac joint, which is, we term this SI joint, formed where the sacrum and the ilium meet. And another is the symphysis pubis, where the bones meet in the front. So what about lower back, buttock, and thigh pain? Well, studies have implicated an unbalanced hip, and most adults with low back pain have this. The dysfunction in the hip may be a primary factor in the development of lower back pain, and many reports state this. On confronting a patient in severe pain of sciatica, which his leg pain is, the first thought should be sacroiliac, not disc. With manipulation, surgical treatment is forgotten. The nerves from the spinal column in the lower back and the hips connect to the bladder, kidneys, prostate, pelvic organs, and the uterus and lower intestines, and it is important to ensure that these nerves to these organs are free of any irritation, compression, or stress. In fact, for over a century, chiropractors have noticed that any intimate relationship between spinal health and hip sacroiliac and the like problems. When your hips are uneven, one appears longer than the other. There's pressure is placed on the long leg when you walk. The knees, hips, ankle, and feet of that side of the body may show pain and pressure. This is the most noticeable when you lie down and is often used as a chiropractic test. Since childhood is it's a very physical time full of falls, accidents, cuts, scrapes, and occasional serious injuries, children should have their spines checked regularly, including their hips, their leg length, and their SI joints by a doctor of chiropractic. They want to be ensure that they are free of subluxations as they grow. Chiropractors and body workers often have observed that a stressful birth can damage a child's spine and body structure and can cause problems in adult life. And if not corrected, that it was shown in 2 different studies in the JMPT in 1984 as well as the Journal of Manual Medicine in 1992 that they can grow to have back pain that lasts a lifetime. This is especially important for children's sake to get a routine lower back checkup or a spinal checkup in general. Well, I hope this information was informative. I'm Dr. Kim Carlucci. Once again, chiropractic brings out the best in me. Let it bring out